doing for the last few years, and to give you perhaps a slightly different perspective on osteoporosis. Now, this is epidemiological work. It is not basic science, but it does coalesce and goes along with some new basic science regarding osteoporosis. The topic of my talk will then be osteoporosis. Could it be related to microvascular disease? And I have no conflicts of interest regarding this talk. Now, we know that the blood vessels are important for bone. In embryogenesis, new bone formation is actually preceded by new blood vessel formation. And in bone healing after a fracture, new blood vessels form at the site of callus formation. We also know that there are some primary diseases of the microvasculature in bone, like AVN, avascular necrosis of the bone, and something like sickle cell, which can infarct the small vessels and also lead to microvascular disease and hip fractures and other fractures. Wrong way. So the question and the data that I want to show you is, are there markers of microvascular disease outside of the bone that can reflect risk of bone fracture? Now, there have been several studies in the last few years in basic research showing that the capillaries inside the bone, the intraosseous blood vessels, capillaries, contain cells that release all kinds of growth factors and proteins that coordinate the building of bone and the ratio of bone formation to bone resorption. And if these blood vessels and the cells, the endothelial cells within them, are lost, either to disease or most commonly to aging, then you can develop a bone disorder with the phenotype of osteoporosis. And here's a list of several studies. There was one study in Nature a year ago from Adams et al. From the Max Planck Institute, which showed that the intraosseous capillaries actually consist of two types. One is the type of blood vessel, the capillary that goes into the capillaries, into the bone in bone that is subject to osteoporosis, and then the capillaries that go out of the capillary networks inside the bone. And this is a cartoon from that article in Nature, and it's an article that contains 90% just staining of bone cells. But you will see that on the left side, there is a capillary into which blood goes in. Oopsie. Over here, and there are all kinds of H cells that release factors associated with building bone. As one gets older, these cells here are lost, and you just have the network, but no cells that lead to the formation of bone. So what is the clinical evidence that I want to show you that not only intraosseous but extraosseous capillaries and small vessels can lead or be associated with fractures? And the three that I picked are the retinal blood vessels, the renal blood vessels, and brain blood vessels, the small ones in each of these organs. Now, this is a study that we published several years ago showing that microalbuminuria and macroalbuminuria from a study of approximately 26,000 people who had hypertension and were treated with ACEs or ARBs, the on-target Transcend study, and we looked at those who had albuminuria and then asked, do the people who had albuminuria, either micro or macro, do they have more hip or pelvic fractures? And you will see that in unadjusted analyses, people who had microalbuminuria at baseline had approximately a 50% increased risk of fracture, of hip and pelvis fracture. After we adjusted for various factors listed here, that association was attenuated. On the other hand, if you had macroalbuminuria, more than 299 milligrams per gram creatinine, you will see there was approximately, after adjustment, a 70% increased risk of developing a hip or pelvic fracture. The p-value was borderline, but it did fall under 0.05. Now, in another study, this one is the cardiovascular health study, which is kind of like a Framingham study of older people over the age of 75. And in this study, we looked at the association of microalbuminuria or micro or macroalbuminuria with hip fracture. And again, we came out with the same kind of results as in the prior study. This is if you break micro from macro. Obviously, with macro, you have a lot more hip fractures. And this is in micro and macro together. And this is in women. In men, we did not find a strong relationship, although there was still a difference. This is a study from Norway by Jorgensen, and this was reported many years ago in the Archives of Internal Medicine, once again showing the more albuminuria you have, the stronger is your risk for developing a vertebral fracture. Now here he didn't use albuminuria, he used the albumin-creatinine ratio as a continuous variable, and the more protein in the urine, the greater was the risk of vertebral fractures. They did not have a lot of hip fractures, but they did have vertebral fractures. This is a study from Australia, the Blue Mountains Eye study, and these are people who have diabetes. And again, if you have any form of retinopathy, your risk for developing a proximal humerus fracture, which can also be an osteoporotic fracture, went up. Again, significantly so. There are wide confidence intervals, but it's still a large relative risk. And this is one last study. Sorry, it didn't show up too well on the slide, but what you will see is that this number over here, that the hip fracture risk goes up with macular degeneration, another degenerative microvascular disease of the eye. Now, wouldn't you know it? Okay. This again is a study that we did in the cardiovascular health study, which is a study of older people in the US that we've been following for 15, 20 years now. And again, here we looked at here we did a three-way analysis. We asked, we know that what percentage of people with hip fractures have cognitive impairment? Anybody? it's about 40 to 45% of people with hip fractures have cognitive impairment. Of them, 20% have dementia, and another 20-25% will have mild cognitive impairment, which precedes dementia. And you will see here, these are people who are normal cognition, these are people with mild cognitive impairment, and these are people with dementia. You will see that the risk of hip fracture goes way up. And the question is, why? And again, these are, before I get to that, we divided up hip fracture into those who had Alzheimer's type dementia and those who had vascular type dementia. Pay attention that those with a vascular type of dementia had a higher risk of hip fracture than those with an Alzheimer's type, type of dementia. And then we started looking and saying, we were in the cardiovascular health study, believe it or not, they have everybody, this is a cohort of about 5,000 elderly people, and 3,500 of them have had 2 sets of MRIs of the brain, so it's a very rich data set. And in addition, people have had retinal photographs done, and they've been read by Ron Klein's group in Wisconsin. And what we found in this cohort was that people with lacunar infarcts and dementia, their risk for hip fracture was 2.5 times higher than people without dementia and without lacunar infarcts. We also found, if you go down another category here, that people who had white matter disease, more severe white matter disease, the periventricular white matter that is around the ventricles, that if you had mild periventricular white matter disease, your risk was not all that increased, but if you had a greater degree of white matter, then your risk again for a hip fracture among people with dementia was 2.5 times normal. And again, if you had retinopathy and dementia, your risk was much higher for a hip fracture than it was if you did not have the retinopathy. And what we found was that the higher the amount of albuminuria, the lower was your risk for a hip fracture if you had dementia. In other words, if the risk for dementia for having a hip fracture was X, and then you adjusted it for increasing amounts of albumin creatinine, the association between dementia and hip fracture went away, suggesting that the factors that are associated with albuminuria may actually be associated with or lead to hip fracture in cognitive decline. In other words, the microvascular association, the association between dementia and hip fracture was related to the factors associated with having increasing amounts of protein in your urine. And this is showing it to you graphically. Up here you have no protein and the risk of dementia and hip fracture is high. The minute you start getting more and more protein in the urine, that risk goes away. In other words, albuminuria mediates the association between hip fracture and dementia. Now, there are other studies that also suggest that there is a microvascular association between hip fractures and microvascular disease. And these come from radiological studies, and Most of them have been done by Dr. Griffith in Hong Kong. First of all, if you take hip fracture specimens and you take hip specimens from people who are having hip replacement for arthritis, and you do studies to check how much blood goes through the two specimens, fracture versus arthritis, the people who have the arthritis have approximately 50% more blood flow than the people who are having the hip replaced for osteoporosis. That's one thing. And then Dr. Griffith did a T1 weighted MRI scan, some dynamic studying of the blood perfusion of the hips. And what he found was this is perfusion through a healthy hip, and this is perfusion through an osteoporotic hip. In other words, it was decreased. I'm not going to go into the characteristics of how he did this because I'm not a radiologist. And here's what I just said before, that people with hip fractures have their hip fracture specimen has lower perfusion than those from hip replacements for arthritis. So that's pretty much it. So what I've shown you are a few things. First, there is basic research to show that if you lose, as we age, we lose the tiny capillaries that go into the plexus in cancellous bone. And this plexus, the arteries or the capillaries going into it contain cells that are associated with the production of bone and bone health. I've also shown you that albuminuria is associated with hip fractures as well as retinal vascular eye disease and white matter disease of the brain, which is also a small vessel disorder of the brain. And last, I've shown you some radiologic evidence suggesting decreased perfusion of osteoporotic bone compared to non-osteoporotic bone. Now, we know that the primary factor for osteoporosis is aging. And also, for women at least, the loss of female hormones. Microvascular disease goes up with aging, so it is consistent with what we know already. And I'm not saying that microvascular disease causes loss of bone density, but it is an additional factor to consider when we are looking for reasons for osteoporosis. The factors that we have now will only, I believe, explain about 50% of osteoporosis or risk of osteoporosis. So I'm putting forth this hypothesis that the addition of microvascular disease may lead to further osteoporosis. And this microvascular disease is not only inside the bone, the cancellous bone marrow, but also elsewhere in the body, that it is a systemic disorder of the microvasculature. I'll be willing to take questions.